Dear friends, vaccination of COVID, there are a lot many doubts in the people, like whether to take it or not take. So it is the time we wanted to give an awareness program on COVID. So today in this situation, introduce a doctor, Dr. Vijay Yeldandi. He is an eminent doctor in infectious diseases. He is a doctor from Chicago University, and he is a very, very renowned personality in international medicines, and his specialty in infectious diseases like immunomodulation and immunotransplantations and kidney diseases, various infections. He is working for many universities. Now presently he is with the Chicago University. Today we are coming forward with this doctor's interview. Please follow and take the guidelines and protect our life and protect the society.
Greetings. Thank you for taking the time to look at this video. What I'd like to talk about is what to do about COVID. And the first and most important thing to understand is what to do about COVID is best decided by the evidence that is present, not by somebody's opinion, not by my opinion, not by anybody else's opinion, but what is the evidence? Now we all know that anybody who gets infected by COVID may potentially have symptoms, and some people do become ill. But of all of the people who get infected by COVID, it's less than 10% of the people who develop illness, and very few, maybe less than 1% of the people actually have a fatal illness. So if you have an illness or an infection where 90% of the time the body gets rid of the infection and has no trouble managing the illness, then anything that we propose as a treatment must be better than 95% effective. Which means that if you want evidence of efficacy, evidence that something is going to be effective, you need to look at a scientifically well-designed, very large study. This translates into studies that have thousands of subjects in them, not small studies like 200, 300, 400 people that we see reported on in the general media and social media and on WhatsApp University. Those trials are meaningless. If you look at the most credible trials, large trials that are done, either by the recovery group or the WHO or reputable institutions in the West, they all have very large numbers. For example, the only agent that has shown reduction in mortality, dexamethasone, was proven with a study with thousands of subjects. It takes that kind of a study, that kind of numbers in a clinical trial to provide credible evidence that we can take and say, look, I can offer you a treatment that has a reasonable probability of benefit for you. Apart from dexamethasone and anticoagulation, that is using a blood thinner and oxygen, no other interventions have shown a reduction in mortality. Remdesivir has never shown that it saves lives. At best, under certain circumstances, possibly remdesivir may reduce the duration of illness, but it has never been shown in well-designed clinical trials to actually save lives or be better than what the human body can do itself to get rid of the infection and illness. Under these circumstances, I urge you not to be seduced by all sorts of things that people are dispensing. In particular, there is no evidence that agents like doxycycline, hydroxychloroquine, ivermectin, azithromycin, high-dose vitamin C, high-dose zinc, high-dose vitamin D are of any benefit in either the treatment or prevention of COVID-19. And many of these agents can have significant toxicity. So please be careful, please avoid these. There is no proof that any of these agents will provide a benefit. What we do know for sure, for which there is incontrovertible evidence, is in those people whose oxygen levels have fallen below a saturation of 94%, they do benefit from dexamethasone, they do benefit from a blood thinner, and they do benefit from oxygen. Apart from looking at oximetry, the only other things that may be helpful is looking at the CRP, which is a blood test, C-reactive protein, which is a marker of inflammation, looking at D-dimer, which helps to predict the risk of blood clots, and possibly ferritin, because some people who have very high ferritin become very ill and require very close monitoring. By and large, you should remember that the body is likely to get rid of the infection and reduce the illness on its own, and at best, you may benefit from some anti-inflammatory treatment. There is some modest evidence to suggest that very early treatment with anti-inflammatory agents may be beneficial for some people. Not for everybody, for some people. But it is very clear that if oxygen levels are falling, the only agent to be shown to be clearly beneficial is dexamethasone, not exceeding a dose of 6 or 8 milligrams a day. There is no benefit from giving high dose steroids or higher dose of dexamethasone. In fact, it is a risk factor for getting into trouble with other infections later on, because we know that some people with COVID-19 infection get into trouble with other infections like tuberculosis, aspergillosis, mucormycosis, and pneumocystis. COVID in and of itself is a profoundly immunosuppressive infection, and therefore it makes sense for us to avoid, as far as possible, any treatment that will further reduce the immune system. So once again, I would like to reiterate, please do not be seduced by any kind of testing that is not required. A CT scan is not required. The CT scan does not correlate with the oxygenation levels by and large. It is not required to take all sorts of vitamins as prophylaxis. They don't work. It is not required to take remdesivir. In my opinion, it has very little benefit. I personally do not recommend it for any of my patients. Stick to what works, for which we have proof, not opinions. Do not take my opinion. Look for proof, look for evidence that you can take home. And above all, remember, the best way to avoid COVID-19 is plenty of fresh air, clean hands, a clean environment, and vaccination. Thank you.